Okay, so sitting to my right, we have a variety of antivenoms. These are all manufactured outside of the U.S. There is an antivenom produced, well, it's not really produced here in the U.S., but it's FDA approved for use in this country, that is Crofab. I don't have an example of that here, but I do have the anti-serum that they're trying to get approved right now for use here in this country, which is the Mexican product, Bioclon. But these other ones are just examples of foreign antivenoms that would be used for exotic snakes. And antivenom comes in two forms. One is the liquid form, which if you look at the Australian polyvalent, this is for all Australian snakes. You can see it's a liquid. And the other way you can get it is lyophilized. This is Thai Red Cross Malayan Pit Viper antivenom. And hopefully you can see in there it's a dry powder or cake. It's basically been freeze-dried. And freeze-drying has a huge advantage because it increases the shelf life of the antivenom, so the expiration date is longer. And it also is stable at a wider range of temperatures. So it's very good for places in the world where refrigeration may be hard to come by, that are very hot places. So that's why some antivenoms are lyophilized. There is some mythology surrounding antivenom and its use. One thing that we frequently hear, people ask us about the safety of antivenom, and especially here in this country, in the United States, antivenom is safe and it's been well tested, and it's not something that you have to worry about. If it's given properly in a hospital, which it always should be, it never should be given outside of a hospital setting, it's given through an IV, then people are there who can cope with any adverse effects. Any medicine has some risk of having an adverse reaction, and that's true of antivenom too, but overall it's very safe. And if you are in a dire situation, if your snake bite is very severe and there is a good chance you may have long-term tissue damage or even death as a result of the snake bite, you need the anti-serum. That's really the only thing that's going to be able to help you. Another thing that sometimes we hear, especially from individuals who like to keep exotic venomous snakes here in the United States, is that it is impossible for a layperson to obtain foreign antivenoms. And actually, you can obtain foreign antivenoms. It is kind of a lengthy process filled with paperwork, which nobody likes to do, but it certainly is possible. You just need to get in touch with your physician and have them help you. They have to be the responsible party, and you can get a license from the FDA. It's called an Investigational New Drug License. And then you also have to get a permit from APHIS, which is the Animal and Plant Health Inspection Service, in order to import it into the United States. And then you can purchase it directly from the manufacturer in the foreign country. It is illegal to sell foreign antivenoms in the United States. So we have this for our use here at the zoo. I can't sell it to anyone because, according to the FDA, it's an investigational drug. So it's just for emergency use, and that's why we have a license to have it here, because we have the snakes that we do. Another misconception about anti-serum is that it can prevent all tissue damage. Unfortunately, that's not true. Tissue, you got to remember, refers to pretty much anything in your body. It can be anything from your skin to your bones to your blood. And so when physicians talk about tissue damage, they can be referring to tissue anywhere in your body. And I think some statements that people over here who are not physicians makes them think that anti-serum is going to stop all tissue damage. Local tissue damage at the site of the bite is frequently caused by digestive enzymes in the venom, and those are very fast acting. Usually, just within seconds to minutes after the bite, those enzymes are going to start destroying tissue at the site of the bite locally. And antivenom is not able to stop that for two reasons. The first reason is you're generally not going to have antivenom that quickly. You should always strive to get antivenom within an hour of the bite, at the very most within 2 hours of the bite. Even if you get it in under an hour, that's not the same as seconds or minutes after the bite, and so the antivenom isn't given soon enough. And the second reason is, even if the antivenom were to be given immediately after the bite, it still has to go through your circulation and get to the bite site in order to neutralize the venom that's there. And again, that's just not going to happen fast enough in order to be able to stop tissue damage right at the site of the bite. What antivenom can do is neutralize the venom that's circulating throughout your system, and it probably does prevent tissue damage to organs or tissue elsewhere in your body, but not the tissue that's right at the site of the bite. The last thing I'd like to mention about exotic or foreign antivenoms and their availability in the U.S. Is that a lot of times some individuals who keep venomous snakes assume that because somewhere in the country or somewhere in their half of the country there is a zoo or other institution that has the antivenom, that that's good enough. And I really strongly feel that that's not good enough. The reason for that is, if you don't get the antivenom within 2 hours, if you have a serious bite, then you can have permanent tissue damage from the actions of the venom. An example of that would be a cardiotoxin may cause permanent damage to the heart if the antivenom isn't received within 2 hours. And if it's not very close, like in your hand, when you get to the hospital, there's going to be a much longer delay than 2 hours in order to get the antivenom to you.